Hey guys, I just wanted to do a quick wrap up of this week's journal entry on conscience clauses. It's actually one of my favorite journal topics, and I'm really glad we save it until the end of the semester because it is quite a polarizing issue, and I usually get responses that are very strong opinions, sometimes before or after. But I hope that by this point in the semester, you've seen, particularly like on your journal entries, that I don't try to penalize your grade if your view is different than mine, but I just try to make sure that you hear my thoughts as well, because it's another perspective. But so here's my point of view when it comes to the conscience clause issue. I mean, it's a really tough subject, but some background information is when it comes to medicine, medical students and residents, they are not forced to learn procedures that they disagree with. Um, so, people, medical students, and residents who are against abortion do not have to learn how to do that procedure. Um, in another physician analogy, the physician can, and often they do, refuse certain procedures or courses of treatment based on their personal moral beliefs. Most of the time, they do this where they're going to just choose their specialty, where it's not going to put them in any sort of morally compromising procedure to begin with. Um, but I do also know physicians personally, I'm friends with them, who they refuse to fill certain um, medications that some people would consider routine pain medications to patients based on their own personal views when it comes to addiction. I think they have that right. So I am a fellow licensed healthcare professional. I am a registered pharmacist. I went to professional school. And so it stands to reason that I should have that same freedom. Um, but unlike physicians, I have significantly less ability to limit my practice area. So they can choose a specialty. There's not really that terribly many specialties available to pharmacists. That is improving. But when I worked in industry, I did work for a company that did respect our right to refuse. And as polarizing and as strong feelings, as this issue can come up with, it's actually really quite rare to see. Um, I practiced for 8 years, and in those 8 years, there were three times where I refused to fill a prescription based on moral grounds. And what ended up happening was that I personally prefer that the drug that I refuse not be used at all. But I do respect that the patients and their prescribers do have a relationship, that I'm a part of, but they have a relationship outside of my participation as well. So if this patient prescriber or provider relationship says that this medication is necessary, I can't accept that happens, but I have a right to not be involved in that myself. So I went to school, I have a doctorate degree as well as a license to practice. So the trick comes down to, for me, is how you handle the situation. So in two of the cases, of the three cases, um, I was not the only pharmacist working. So I had a partner pharmacist who was fine with the issue. So they took care of it for me. One was a man and one was a woman, partner pharmacist, but I wasn't the only one there. And so I didn't have to be involved in the dispensing, which helped me. That was, my conscience was clear, but the patients still got what they needed. They didn't even they weren't even aware that I had an issue. There was nothing that interrupted their experience, because I sure wasn't going to be like, oh, I don't want to fill your prescription. No, not going to do that. But in the other instance, I just was able to contact a sister store that was just, very close, and transfer the prescription. And so they were able to get the medication and their treatment wasn't interrupted. So, ultimately, I felt okay with that situation. And those are the only issues, that I've had, yes, you can bring up a lot of other hypothetical scenarios, but again, in 8 years, I've only had those 3 issues and they were okay.